Hello, this is Dr. Gay from First Look MRI, and this is an 18-year-old male who injured his knee about 2 weeks ago, had continued pain, and came in for an MRI here. And we have two images in the same orientation. This is a coronal orientation where the femur is here, the tibia is here. This is the inner side or medial side, outer side. This MRI was done without fat suppression, so fat is really bright. We call it hyperintense, has lots of signal. Marrow has lots of fat, it's bright. On this one, the subcutaneous fat and marrow are dark because fat is suppressed. We call this a fat suppressed sequence. And in this view, we see the problem along the medial side. We have the medial collateral ligament, which is this dark band. It comes down, it's pretty straight here, looking normal near the femoral attachment, but as it gets to the joint, it becomes lax. And over here, we see this band of intermediate signal between the bone and the medial collateral ligament. On this one, we see the fluid signal really stand out. The marrow is dark and the medial collateral ligament is dark, and we see that there is granulation tissue or edema here between. So this is a periosteal injury where the medial collateral ligament, where it attaches, it's stripped off, and it has reparative tissue here, some probably granulation tissue or maybe even blood products there, and the medial collateral ligament is uplifted, and again it is lax. So this MCL is significantly injured, not doing its job. The patient also had one more finding, which is just below. There's some other tendons down here called the pes anseurine tendons. There's sartorius, gracilis, and semitendinosus, three tendons that come around the back, the thigh, and they wrap along the medial and back side, and they wrap down, and they attach right along the undersurface of the medial collateral ligament and a little bit more anterior. So they attach right about here, and they are also sprained, so they're not completely torn, just sprained. You can see them down here as well. Now, normally when the MCL tears, it's torn up high near the femoral attachment, and usually it's really thickened and edematous and irregular. In my experience, when the MCL tears distally, it seems to peel off like this, and we see an intact MCL, and we just see the periosteal injury and the uplifting from the tibia. And this patient also had one more finding over here. This is a little bone bruise on the lateral femoral condyle, and so the mechanism of injury was the tibia went out this way, which really stretched these tendons and ligaments, or this one ligament and these tendons, and caused the injury over here, and then it impacted over here. So the tibia impacted with the femur, has a little bone bruise. Over 2 weeks, this has probably got a lot better. Just a little bit of residual marrow edema, but this MCL injury and pes anseurine tendon injury is not healed yet. And that's it. Thank you so much.